South Korea usually reports a decline in coronavirus infections on Mondays, with fewer tests having been done over the weekend, and today's decline was unusually large. For the first time in weeks, there were fewer than 200,000 cases. Officials do think that the country has by now passed the peak, but severe cases remain relatively high. Choi Min-jung reports.
South Korea has reported fewer than 200,000 COVID-19 cases for the first time in more than 3 weeks. The country on Monday confirmed 187,213 new infections. Health authorities said the spread of the virus is now on a downward trend after passing the peak of the Omicron wave. Given the current trend, authorities are considering whether to relax the current social distancing rules from next week. However, officials are still on high alert over the increasing number of severely ill patients and deaths. A record 1,273 patients are currently in critical condition, and there were 287 additional deaths.
The number of critically ill patients and deaths could reach a peak in the next 2 to 3 weeks, so we can't let our guard down. The number of people in critically ill condition increased by 1,130 on week. On top of this, stealth Omicron is spreading viciously around the world.
Last week, stealth Omicron accounted for 56.3% of infections, and it has now become the dominant strain. More concerning is that the number of infections among people aged 60 and above is increasing rapidly. People in this age group accounted for around 10% of infections in early February, but as of Sunday, the figure has doubled to nearly 21%. The age group accounts for 85% of those in critical condition and 95% of deaths. Against this backdrop, authorities have maintained the country's pandemic risk level at its highest point for 4 straight weeks. Meanwhile, authorities have signed a deal to buy 200,000 additional courses of Pfizer's Paxlovid. With those extra pills, the country has now secured a total of 1.2 million courses of oral medication. Choi Min-jung, Arirang News.